Well, hey, everybody, this is Robert, and welcome to Outbreak News TV. Now, May is Mental Health Awareness Month, and on today's show, we're going to take a look at four mental health issues. We're going to look at anxiety, adult ADHD, PTSD, and depression. Yes, this is a little bit different than our typical podcast on infectious diseases, but I do like to dive into other areas of health every now and then. So, joining me today to discuss these issues and his personal story is author and social psychologist Jamie Hughes. Hi, Jamie. Welcome to the program.
Hey, Robert, how's it going?
It's going well. Glad you could make it. And let's go ahead and dive into these four different mental health issues. But before we do, can you give the audience a short bio on your work, your education, and your books?
Sure. Yeah, no problem. So, an interesting question for the audience. Wouldn't it be nice if you had someone that was, mentally and emotionally stable, was able to see a direct path that they wanted to take in their career, go in that direction, work for it, earn it, and succeed in whatever their endeavor was? That would be nice, wouldn't it? So, here's a little bit of my success, and then I'll answer that question. So, I have a bachelor's degree in applied psychology, a master's in social psychology with a specialization in trauma, um, self care, and resilience. I've worked in two nonprofit organizations. One, I worked in children's hospitals working with severely ill or injured children and their families, doing program development and management, and also some direct work with clients. And then I worked in the domestic violence and sexual assault field for many years, doing program development, program management, fundraising, recruiting, you name it, public
Mhm.
speaking, all that kind of stuff. I just a few accolades. A member of the Society for Police and Criminal Psychology. I'm a certified professional life coach, a member of the National Association for Poetry Therapy, and a certified therapeutic writing instructor. And I say all that, and not just to fit your question of an intro bio, but to say the question I asked at first, wouldn't it be nice if you had a person? I didn't meet any of those
Mm.
to get where I'm at today. I had childhood trauma, massive childhood trauma, trauma for years, abuse, mental illness. Didn't even begin to get help until probably my mid 20s, and that was after a suicide attempt. So it's amazing that once you find the right path to help on some of these issues, you can overcome them, you can grow and heal and still, reach your goals and be successful.
Hey, good stuff. And we're going to go ahead and talk a little bit more about your personal story a little bit later in the program. But I want to go ahead and look at these four mental health issues. These are actually four that you mentioned to me via message.
Hmm.
And I thought that would be a good way to go with this. Let's start with anxiety, Jamie. Now, of course, I get anxious periodically, but that doesn't mean I have a mental health issue, right? So this it can be a part of normal life, but what are we actually talking about?
Yeah, so anxiety is a normal part of life. We all have stress, we all deal with stress, and that's normal. And sometimes, we'll use the term anxiety and we're really talking about nervousness. Same thing. That's your normal thing. Everybody gets some anxiety if, like, some people get anxiety from public speaking. They
Mhm.
got to speak in front of a crowd. If you got a deadline at work, if if there's a problem and you need a solution by tomorrow and you don't have that solution, you're going to be anxious, and that's normal. um, Clinical anxiety, when we talk about that, is when you have a response in your body to sometimes perceived um, stimuli. So, not just a circumstance that exists, it may not even really exist. It's just what your body is picking up on. Sort of that when we talk about the survival mechanism, most people have heard of fight, flight, or freeze.
Mhm.
That's that anxiety we're talking about, where those instincts kick in for sometimes no reason and absolutely kick in out of control. The body gets into this mode where you have these experiences, and no matter how much you try to talk yourself down, it seems so overwhelming that you just can't do it. So like having a panic attack, that's a symptom of extreme anxiety. So when we talk about clinical anxiety, we're talking about what you might feel from a nervous situation, but in a person's mind and body all the time,
Constant.
recurring basis and out of control.
Now, when we talk about anxiety, though, there's different types of anxiety disorders, right? I mean,
Yeah.
was there a handful? Can you go over
Yeah,
those?
sure.
Yeah.
Yeah, there's a couple. Most of the time, if we're talking about anxiety as a mental health issue, you're talking about GAD, which is generalized anxiety disorder. And that's pretty much what we're describing. A person has this issue, this response in their body, along with their thoughts, racing thoughts, things like that. And it's a condition they have and they deal with on a regular basis. And it has an impact on their lives. So it's not just, again, it's not just being nervous because of a scary event or whatever. It can affect them. You also have, like, social anxiety, which is most people have heard of that too, even if they haven't had it themselves. And that's more of, you take those same circumstances, those same symptoms, but instead of it just kind of coming and going on a regular basis, it usually just happens when they're in a crowd or perceiving that they're going to be, in a social situation. So that's often called social phobia as well. And then you have separation anxiety disorder, which is where usually something has happened in childhood, a separation normally from the parent or caregiver, and it has affected the child in such a way that even into adulthood, when there's a real or perceived separation coming, it goes out of control in their body and then their reactions. Um, and then you would have like more specific phobias, which are also classified as anxiety.
And what types of risk factors? You mentioned the one about separation, so that's obviously the risk factor. But
Mhm.
what other types of risk factors do you see with different anxieties?
Yeah. So, and this is something we'll kind of mention as we go along with all four of these issues,
Hmm.
and that we've reached a point in science and psychology and biology to where we know for a fact that mental health issues can be genetic, they can be environmental, or they can be a combination of both. There's studies that can prove one or the other, genetics or environmental, and both have their strong points. And that's also another reason to say, okay, look, both of these can be true at the same time, and we don't know for 100% sure if it's one or the other. But trauma obviously can lead to a mental health disorder, genetics, um, other medical conditions. So you could have, um, you could have some sort of, like, well, let's just say we'll pick cancer, and let's say you have cancer of an internal organ, and that particular organ is affecting hormone balance. So if you disrupt the hormone balance, it can lead to a mental health disorder. And some of the environmental factors, like uh, chemicals in our food. Um, Absolutely, there's so many studies. I know it's kind of a political hotbed issue at times, but it's proven it affects it, and things like prenatal care. So alcohol or tobacco use, or toxins from the mother goes in the bloodstream, affects development of the baby. That can lead to mental health issues as well.
So for anxiety itself, how is it typically diagnosed? Is this just a one-on-one conversation with somebody? I mean, it's not like you can go to LabCorp and have a blood test,
No,
right?
no, not for that one. No,
Yeah, yeah,
there's several other issues. Yeah, but
yeah.
no, anxiety is probably one that you can talk to your therapist about. You could talk to a counselor. You could talk to a coach that has some experience in that area. And if you know, lay out enough symptoms and show what you're dealing with on a regular basis, for how long you've dealt with it, that kind of thing, then they can not diagnose you medically, but they can say, okay, yeah, look, this sounds like what you're dealing with. Go
Mhm,
see your doctor. Only a medical doctor or psychiatrist can give you a medical diagnosis for these issues,
mhm.
but a regular mental health therapist can can get the label, usually get the label right to get the ball rolling.
Gotcha. And as far as treatment, and I guess this is my question for all the treatments for
Hmm.
the four different disorders. Uh,
Hmm.
is it all pharmaceutical based, or is there something else?
No, absolutely not. And this is one of the things, this is one of my favorite subjects because of some of my personal story, but also because of, you know, learning more and more as I've gone along in my education and career, is that, psychology is just like other science. We kind of have to look at it historically, and we're really just, in terms of modern medicine, we're only about 150 years into the study of psychology. And it's gone through many changes and growth periods. And so, for a while there, it was kind of like, well, medicine is the only way to treat these things, or maybe talk therapy was the only way to treat these things. And we've kind of now come back full circle to even before psychology was a science, and we're realizing that, wait a minute, the things we do, um, and how we live can have a negative or positive effect on these issues. So in other words, yes, absolutely, medicine will help you um, mitigate or manage symptoms. Absolutely, 100%. Talk therapy will help you get to the root of the issues if it's from trauma, um, and help you have a better understanding. Absolutely. But lifestyle changes will help you have long term growth and healing, because it's not just in your mind. It's not just, oh, this happened to me a couple years ago, so I was traumatized and I'm having bad memories, and those bad memories are causing my emotions. No, the hormones in your body, the way that your body is able to absorb and use nutrients, those those feed into your mental health. Physical health is mental health. So just like you pointed out, this is going to be true for all of these, is that medicine absolutely will help you get get the ball rolling. And for some people, it that may be a lifelong process,
Mhm.
but not for everyone. You can start and then progress, or learn what works for you as you heal. And then therapy, just what we would consider normal therapeutic practices, and then what we're going to call somatic therapy. And somatic therapy just means it has to do with the body, um, what what your diet is, what your exercise is, those kinds of things.
So when you're seeing I come to see you as a psychologist. We have the classic picture of somebody laying on the couch, and
Yeah, yeah.
what's this? What's this? What is the scenario really though? What does it look like?
So the first thing, and that's a great question, because, and I actually, when um, I wrote the books on these four issues,
Hmm.
that was something I wanted to include in there, was for people who maybe had not been in therapy for, like, 20 years, or had never been, and didn't know what to expect. Uh, the first thing is that when you talk to someone initially, it's just like an interview. It's just like an interview. Your
Mhm.
very first conversation should not be diving down deep into, childhood trauma. It should be more like an interview. And the interview can go like this. You're looking for the therapist that can help you. So you want to ask the questions that are going to help you, that you need. So, hey, how much experience do you have with this issue? This is what I think I'm dealing with. I'm just anxious all the time for no reason. Do you have experience with that? Okay. What's your approach? What is your um, demeanor? Are you more, I don't want to say aggressive, but more blunt, or you're more soft? And you can kind of think about that to yourself, like, okay, in relationships or with my parents or even with friends, who who do I jive with the best? Do I like people being very direct and blunt, or is that offensive to me? When someone comes and says, that shirt's just ugly, you need to get rid of it. Do you kind of laugh it off and say, yeah, yeah, you're probably right. You can take direct. But if you
Mhm.
get offended and you're like, how dare you? I don't want to hear, I don't even want to talk to you again. You don't need a direct therapist either. You need someone that's going to be more compassionate and slower, you know. So ask those questions. And also, you want to ask, how long do you think this is going to take? And I don't mean like 30 minutes or an hour. I mean, do they have a plan when you walk in the door to get you out of the door? A good therapist should say, well, I can't tell you a date. However, here's our goal. Our goals are to find out the issue, find out what root causes there are psychologically, and then start building resilience. So that's the kind of things you should look for and ask. And if it doesn't meet, what you're looking for, that's okay. It's, there are other therapists that have other styles, and it's okay to do that. And when you go to therapy, that's basically what your goal is one is to talk about the current issue, how long it's been going on, what's your
Mhm.
symptoms, how it's affecting your life. And then there should be a somewhat of a mixture of, let's help you deal with the here and now, and go back and try to get some healing so that we can work your way out of this, work your way into a healthier state and a more resilient state.
Okay, so it's more two-way than I expected it to be.
Yes.
You always
Yes.
picture the therapist, psychologist asking the questions, and the other person just sits there and
Hmm.
spews out answers. So it's
Yep.
really a two-way conversation.
Yes. Yes. Absolutely.
Right.
Should be.
Okay. ADHD. One of the topics you mentioned in the message to me was adult ADHD. Here we have an acronym. What is ADHD?
ADHD is attention deficit hyperactivity disorder.
All
So
right.
you can see why we use the acronym,
Yeah, right. Yeah.
which
A
is
lot,
true.
lot of syllables there.
Yeah, yeah. So, and ADHD it is a specific disorder, but it is also an umbrella term. So again, this kind of goes back into the history of psychology that I mentioned. So for many years, it was just ADHD, and it was used to diagnose children, hyperactivity
Mhm.
in children. Well, as we go along, then we have adults start coming forth and saying, wait a minute, I have those same exact symptoms, but not necessarily the hyperactivity part, but I have all the others. And then so we started learning, oh, wait, okay. So this isn't just a disorder for children. And actually, that's why a lot of psychologists and a lot of, authors and scientists dropped the H and started using ADD. So um, attention deficit disorder. So they
Right.
drop the hyperactivity part. And even now, I've seen some very recent studies and literature from psychologists that have started using an acronym, AFCS, which is attention and focus challenge syndrome. So they're trying to come up with a more accurate label for the adult version. Um, so yeah, when you talk about ADHD, it might be applied specifically to a child that has it, or just used as an umbrella term for anybody that has that group of symptoms.
And what are those signs and symptoms?
So now, obviously, in the children are mentioned the hyperactivity, but it's interesting because um, with adult ADHD, it's been kicked around. Does it can it start in adulthood, or does someone always have it and it just evolves as you get older and now it's noticeable? Most people, most literature and studies believe that if you've got it now as an adult, you've always had it, but you just didn't have the hyperactivity part as a child, or maybe if you did, it was very mild and just overlooked, and the other symptoms weren't very severe. But as you go through teenage years, your hormones change. As you go into a young adult, your hormones change
Mhm.
again. So it kind of just ramps up, but you've probably always had it. Um, but for adults, the symptoms are usually the inattention. So you have difficulty focusing. You're easily distracted. Squirrel, you know, that is the running joke, but it's true. You can be working on something very diligently and something else distracts you, even in your mind, and you're just compelled to go to that distraction. Oh, I forgot to do this. So you're just stop what you're working on and go do it. And then sometimes you forget to go back to what you were working on. Or if you do, you're like, wait a minute, where was I? Um, so it's
So,
this.
so very much like a child in a way,
Yeah,
right?
yeah,
Yeah,
but a little more, not the hyperactivity part, not the
correct. Yeah.
right. So poor organizational skills, forgetfulness. There's a specific term that we use for or in ADHD called time blindness. People with ADHD, and I want to before I do that, let me backtrack for just a split second.
Mhm.
All mental illness. A lot of people know this about autism, but it's not really talked about much about other mental illnesses or neurodivergent issues. All of them are on a spectrum. So you can have it and you can have a little of this symptom and a little of that symptom, but this other symptom you don't really have,
Mhm.
or it's very mild or extreme. But time blindness with ADHD, some people, it is to the point to where they honestly just don't, their mind loses track of time, and not just, oh, I'm so interested in what I'm doing, I just don't pay attention. But I mean, like, you haven't talked to your brother in 3 weeks, someone that you would normally talk to all the time, but y'all
Mhm.
haven't talked in 3 weeks, and all of a sudden you're like, hmm, they haven't called me, I haven't called them, I haven't talked to them. You just don't know how much time passes, and that's a common symptom. There can be hyperactivity in adults, though it usually comes out in the form of nervous talking.
Mhm.
Um, there's decision paralysis, where you have a decision to make, and your brain literally just like the running circle, like when you're
Yeah.
trying to load software or something or an application, the little circle. I was your brain, it's like it just freezes. It just freezes.
Wow.
Impulsivity. People with ADHD tend to be more impulsive, take engaging in risky behaviors. There can be emotional dysregulation, where they're more sensitive emotionally. So it's not necessarily that they don't have normal emotions like sadness, anger, whatever. It's just they can they go from 0 to 60 very quickly without even realizing it. You know, and then burnout's very common among ADHD. People with ADHD tend to start they tend to be very creative. So they will start projects. Oh, I just had the best idea. I'm going to start a ice cream slash donut truck. Da, 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 da. And they start working on it, and da, 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 and they get into it. And after, a couple of months, it's like, this is just not interesting anymore, which is tied to dopamine. The dopamine, they have
Mhm.
their brain produces less dopamine than the normal person. So when they get a charge of it, it's all exciting and it's all in. I'm 100% in. But when that dopamine starts going down, and
Wow.
they also have rejection sensitivity, extreme reaction or feelings to being rejected. Um, Back to the shirt thing. I don't like your shirt. It's ugly. I'm not picking on you. I'm just using it as an example, but it's taken more personal. It's like, God, they don't like me. It's not like, oh, I heard that they don't like this shirt. They don't like me, and I'm hurt, like emotionally hurt. So those are all common. Again, can be on a spectrum with ADHD.
Jamie, are there any known causes to this, or
Back, same answer. It can
same?
be genetic, can be environmental, uh, like trauma, prenatal issues, exposure to alcohol, things like that. Again, this is one of those. All of these, except for PTSD. PTSD, you can pinpoint a cause, but
Mhm.
anxiety, ADHD, depression, they can come from trauma, but they can also be genetic or combination of both.
So, how you as a psychologist, how do you manage this, or the patient? I mean, you guys working together. How do you manage ADHD in an adult?
So, kind of the same as anything else. One, go to a doctor and see if they're going to prescribe a medication that's going to help you. And the medications really help you. They kind of bring down, typically bring down the overstimulated part, and it kind of gets you to a level to where then you can focus. But you don't want to stop there, because then you're just taking a pill to go to do away with some symptoms. The problem still exists. And
Mhm.
what if there's a change? What if there's a change in your life, your body, the medication? Then you're back to square one. So that is a starting point. Then you start going to um, life skill management. Let's look at your physical health. Let's start working on that. And let's work on what needs to be current. So if you're having a problem with being organized, all right, let's get a notebook, let's get some sticky pads, let's get a calendar, a planner, and let's learn how to run your life and schedule in a way that makes sense to your brain. ADHD specifically, I love working with this partially because I have it, and I've had to learn over the years. Wait a minute, I have this problem. This isn't just a personality trait. This is literally something that's going on, and I need to learn how to work around it. And so the ADHD brain, it's like, you know, knowledge in the back, execution in the front, and there's a disconnect.
Mhm.
You can be smart as hell, you can know everything, you can learn everything, but when it comes to actual doing something about it in the way that you want to, there's a disconnect. So you may have to take extra effort to make up for that. And a planner, again, I mentioned that, planners, calendars, things like that. Those are ways that you can make sure that you're organized and doing things on task in a way that makes sense to your life.
Now, I'm assuming that the same question that I asked about anxiety concerning diagnosis and treatment, they pretty much overlap.
Hmm.
Tell me if I'm wrong.
Yeah.
Um,
Yeah.
but I did have a question about the pharmaceutical aspect. Again, I'm not familiar with these drugs, but is there a lot of risk to different side effects, maybe due to dosage or just the drug itself?
Yes. Almost all of these drugs have the possibility of side effects,
Yeah.
you know. And this is one of the most ironic and absurd things that I think I've ever heard in my life. But I learned this many, many, many years ago, getting into the psychology field, especially for antidepressants. One of the main side effects is suicide ideation.
Yeah.
So you're literally taking a medication to help you not have suicidal thoughts or intentions, and the main side effect is suicidal ideation.
Yeah,
So
yeah.
yes, they can have most people, they're fine. They may experience mild side effects, but it's possible, and that's absolutely something you know. Anytime you're going to start a new medication, my advice is to get someone that's a good support system. Could be your spouse, could be a family member, could be a best friend, whatever. Someone that you're comfortable being 100% honest with, and that can say, it's not going to be judgmental or whatever. And so that you can call and say, hey, look, I'm starting this medication next week. And for the first 2 weeks, I need to be able to call you if I feel funny, if I feel off or something,
Hmm.
because that's when you're most likely to experience um, a side effect. It's in the first 2 weeks. So, yeah, they're real. As far as dosage, a doctor will normally go by the severity of your symptoms. So, if you're hearing voices, those types of things, and that's more common with schizophrenia. But
Yeah.
let's say with, anxiety, if it's to the point where you're having this every single day, and sometimes afraid to leave your house or afraid to talk to someone on the phone because it just, feels so strong, they're probably going to start you on a higher dosage. Um, but if it's mild symptoms, or you've had it off and on, they should start you at a lower dosage or a medium maybe, and just see how it is. And again, it's very important to be honest about these things, with your doctor, with your therapist, whoever you're seeing, because they need to know what's going on. They can't read your mind. So the more honest and upfront you are about what you're experiencing, the more they know to help you.
Yeah. Let's go ahead and move on to PTSD. And then we've been hearing a lot about this. I served in Desert Storm, so that's when I really started hearing about it
Uh-huh.
in returning soldiers. Um, what is post traumatic stress disorder?
So yes, post-traumatic stress disorder, PTSD. And we hear a lot about this with soldiers, with veterans, because that's where it came from. It's where the whole idea came from, was all the way back to, the Civil War. They noticed that, not just at the end of the war, but even during, if there was a specific battle, and after the battle was over, soldiers were experiencing these symptoms. And it's progressed over the years to where by the time we got to World War II, there was obviously more studies of it, and then into Vietnam. After Vietnam, it was a huge push for better understanding, and there started to be a lot of psychotherapy treatment. And so it is specifically a mental health condition that develops when individuals experience trauma. Um, some things that most people don't know, or maybe haven't heard, or just don't think about unless you're, you know, um, involved in a case with this. But you can get the symptoms, and you can get full blown PTSD even from secondary traumatic stress. So just experiencing, hearing about the trauma from others.
Really?
So that can develop symptoms in you, because especially if you hear it a lot, or if it's something very severe that happened to someone very close to you,
Hmm.
your brain latches onto that, and you experience the same trauma, not obviously not the same level, but you experience it too, and you can develop symptoms. Um, so, but one thing we've definitely learned from PTSD study is that it's not just soldiers. Anybody that experiences trauma can develop the symptoms, and if it's the right symptoms, can be full blown PTSD. So it can be a child that is raised in an abusive environment. Um, it can be someone that is in a car with their best friend or with their spouse. There's an accident and that person dies, and they witness it. They don't. They live. They can develop PTSD. Um, it can be from sexual violence. domestic violence. It can be from your job. And there's some neat statistics on that I can share in just a second.
Now, but there's a lot of, I'm using soldiers again because
Sure.
that's right, first heard about it. Um, there's a lot of soldiers that went through a lot of trauma too and don't have any of these issues. What's the explanation for that?
All right.
Is there an explanation?
If we come up with a 100% accurate
We'll be rich,
explanation,
right?
we're rich, right? Yeah. And this has been the question for forever, and something that we kind of have some answers, but there's no guarantee on that. One of the answers is that just some people are more resilient than others. That could be from upbringing. That's our best guess, is that when they were children, their parents, however they were raised to be more resilient. It could be generational. That's a theory that, if your ancestors, grandparents, had a certain level of resilience, then you kind of, adopted that as well. It's a theory. It's not that one's not really strong, but it's possible.
So,
So
Jamie, can I
yeah,
interrupt you, Jamie?
yeah,
You mentioned resilience a few times here, but you also mentioned resilience in your introductory statement. Is
yes,
is that the same resilience that you're talking about?
yes,
Okay.
absolutely. So and just briefly, resilience then is just the idea that you have the um, the inner skills, the inner framework to deal with a traumatic situation from mild to severe. So basically, you just have coping mechanisms internally, whether it's from learned skills or, like I said, maybe it's just genetic. We don't know.
Did you want to continue on what you were talking about before I interrupted you?
Um, so yeah, in terms of just like why it affects some and not others,
Yeah.
that's our best guess, is that some people are either more or less resilient.
Mhm.
Um, and it's also interesting, and this can go in some other discussions too. But every single person sees the world differently. You and I both can be at the same room and see the same event. We're both processing it differently. A lot of that, has to do with history. But our brains just work differently. Our brains are made to try to figure out why. Our brain just subconsciously, if you have something going on, you're subconsciously you're thinking, why did this happen? How did this happen? What's the end result of this? Those kind of questions. So it can go a million different directions, and some of those directions could be, oh, it happened because that person made a choice, or it could be, oh, this happened because I'm vulnerable, and that kind of can have effect on whether a person gets symptoms from PTSD or not, is how their brain interprets the event.
So, so the symptoms that one would present, it's what comes to mind to me all the time is the first Rambo, right? They would start messing with him, and he starts seeing Vietnam, and
Yes.
so so is that a fair depiction of
Yeah.
symptomology? It is.
Yeah, it can be
Yeah.
one of the symptoms, and I think there's uh, five. Well, to be to get the full diagnosis of PTSD, the first symptom is kind of obvious. You have to have experienced a traumatic event. I mean,
Right.
that's kind of obvious since it's called post-traumatic. You know, um, but one of the other symptoms is intrusiveness, which can involve flashbacks, and that's what you're talking about.
Mm-hmm.
It can also involve night terrors. Um, so a nightmare is when you have a dream and it's a bad dream and it scares you. A night terror is when you have a bad dream and it's almost like reliving the experience, and it happens over and over and over. It's not just a one-time thing.
Mm-hmm.
So that's the intrusive symptoms for PTSD. Um, you have avoidance, where people subconsciously and sometimes consciously are avoiding anything that reminds them of the trauma. So they might not even, like, if you're talking about a soldier, if they were best buddies, they were roommates with someone overseas while they were deployed, and they come back and now they're having these symptoms, and all of a sudden now they don't want to talk to that person. That was their best friend. I mean, y'all
Oh,
lived
right.
together for 6 months, 12 months, but they don't want to do that because it brings back the memories.
Right.
um, Obviously, negative mood. So people with increased irritability, anger, depression, those types of things. That's one of the symptoms. Um, another very common one is the hyperarousal, or hypervigilance. Both of those are part of having PTSD, where that someone can just be walking and hear a noise, and just all of a sudden, you know, and it's so fast. It's so fast. It's such an excellent proof that these things that we kind of think about as being only mental, they're not. Your nervous system reacts before you can even think about it. It's like boom, and you don't know what's going on. So there's that hyper arousal and the hypervigilance. Someone is with PTSD is typically, everywhere they go, they're kind of scanning the room. They're kind of looking. Their body expects there to be danger around the next corner.
So is
Um,
that considered a type of paranoia then?
it could be,
Mm.
but a person can have paranoia without having the other symptoms of PTSD.
Mhm.
And this hypervigilance, it's not quite the same as paranoia, because paranoia is sort of, you're afraid, or you're afraid that something is happening that is not real. Doesn't There is no realistic basis for it.
Gotcha. Yeah.
Hypervigilance, there's a realistic basis. It just happens to be in the past
Right.
and not in the present, but your
Makes sense.
your nervous system is constantly thinking as if it were going to happen again at any given moment. um, and then another, um, key factor of PTSD is suicide. So there's a high rate of suicide for people that have PTSD.
Now, is PTSD a lifelong thing, or do people actually ever get over it?
Um, it is typically lifelong,
Yeah.
but with medication and therapy and lifestyle adjustments, the symptoms can be so low and so much under control that a person lives a normal, healthy life, and may occasionally have a flare up if there's some kind of environmental factor, something that happens. Um, but for the most part, yeah, it's treatable. And even with, like, are you familiar with EMDR? It's the and this is
Mhm.
kind of, well, it's been around for a while, but it's sort of more mainstream now, and I'm going to screw this up. My therapist friends are going to cancel me. Eye movement desensitization. Shoot, I always forget what the R is. Anyways,
Anyway.
EMDR.
Uh-huh.
It's basically a therapy method where they take a pencil or a light and have your eye follow
Yeah.
it
Hmm.
while you're talking about the trauma. Like, this is what happened. I was standing there and I heard a gunshot, and next to me, my partner's arm was missing. You're talking about it while it's moving. It's basically rewiring the neural pathways in your brain. And instead of them going straight to um, being super sensitive about the memory, it says, oh, this is just a memory. This is just something I'm talking about. So it kind of takes the edge off. It's had a lot of success, especially with PTSD.
Interesting. Um, and then the last one is depression, which I think most people are at least familiar with.
Uh-huh.
on a superficial level. Um, so for somebody that has severe depression, what are the
Mhm.
signs and symptoms?
So, severe depression then is you, some of the symptoms. One, it's like this, it's a bodily feeling that you would think would accompany severe sadness. So, sadness, we all get sad. Grief, everyone can experience grief. Depression is like that, but there's no immediate reason for it. So your body just feels, I mean, like the worst sadness
Mm.
that you could think of for no reason. Now, you may think there's a reason. You may think, well, it's because I'm this and I'm that. But that's another definite symptom of depression, is that a person has extremely harsh, extremely low self-esteem and self-image.
Mhm.
Um, they There's constant fatigue. Um, it can be very hard to be motivated. So low motivation is definitely a symptom. And all of these, for it to be clinical depression, there has to be a period of 2 weeks or more where these are experienced ongoing. So if you're like this for 2 days, that's not going to meet the qualifications for clinical depression. But um, uh, along with the low motivation to do anything is like a disinterest in things that would normally make you happy, and things that you would normally enjoy. You're just not interested even anymore. Um, your mood is just, it's down. You just feel worthless. You just feel like life can't get any worse, and this is an ongoing internal struggle.
So is this is, is there is I'm sure the causes are multiple, but is there any major causes, or are people born like this, or how does that work?
Yep, it's the same as before. From what
Yeah.
we know, what we can show, it could
Mhm.
be genetics, it could be environment, it could be a combination of both. Um, or, like I mentioned
I mean,
earlier, it
there's
could
got to
be
be some of them. There must be a trigger or something, right? Not really.
no, not
No.
really, no,
Okay.
because we just, it can be absolutely shown. For instance, the number one risk factor for depression is if a parent had depression or a mental illness. So that's, we know for a fact there's a genetic tie. But at the same time, we also know that if you take a child and they go through childhood trauma that's severe or long term, they can develop depression,
Hmm.
even if there was no signs of it before a certain age. So it's both, you
Wow.
know.
How successful is treatment for this?
Treatment for depression has been very good. We've kind of gotten it down to a science, so to speak, on the medication, so that most people with depression, there's a range of drugs called SSRIs,
Hmm.
and depression can have a lot to do with serotonin in your body. And so if you and there's, I want to say there's maybe like 4 or 5 that are like most widely used now, and that are most effective. And you get the right one and the right dosage, and you can be good for a long time. But
Hmm.
I still go back to what I said earlier. Physical health is mental health. You could take a medicine, and yes, it absolutely will help your symptoms if it's the right one, but it's not going to cure some of the root causes. Some of the root causes might be psychological from trauma. Some of them might be physical in other ways than just serotonin. We absolutely know that there's a gut brain link. How your gut microbiome functions affects your mental health, and especially with depression. Even with these other disorders like ADHD and PTSD, if you've got an unhealthy gut, that can cause depression on top of or in correlation with another issue. So the more you treat your overall health, the better your mental health. Can you hear me?
Yeah, can you repeat that, Jamie? Because you slowed down to a snail's pace for some reason.
Smell space. Yeah. I was just saying that the more you treat your physical health, the better your mental health will be because they're connected. They're connected. Absolutely.
Yeah. Now, I guess, I mean, again, this is not my wheelhouse at all. Um, but when I think of depression, I instantly correlate it to suicide.
Hmm.
Um, does it often result in suicide?
So having depression absolutely increases the risk of suicide.
Hmm.
However, most people with depression do not commit suicide. It is much more common, and I think this is something that people with depression often feel, I don't want to say guilty about, but maybe, I don't think that's quite the right term, but they feel bad about. Suicidal ideation is much more common. The difference being that suicide, obviously, you go through an act to end your life. Suicidal ideation can just be, I am so tired of this. I'm so tired of these problems. I just wish I wasn't here. It's not the same thing as saying, I have a plan. I know when I'm going to do it and how I'm going to do it. And I'm going to do this. That's it.
Yeah.
So suicidal ideation or thoughts, morbid thoughts, thoughts of being dead or dying. What if I just wasn't here anymore? Nobody loves me. Nobody would care if I was gone. I just wish I didn't exist. That's much more common with depression. Um, I think, I, I don't know the exact numbers, I forget, but with depression, in terms of out of all the depression, I'm sorry, out of all the suicides, how many that they were able to tie directly to depression. I want to say it's like, maybe like 50 or 60%
Mm.
of all the suicides. So yeah, it's not a one-on-one guarantee.
Yeah.
Um, but yeah, there's a lot when it comes to suicide in the U.S. There's, I think the average is like 50,000 a year of suicides, which I did a study on one time, and it comes out to like, that's like one death every 10 minutes or something from suicide.
Yeah. So sad.
Yeah,
Well, Jamie, when we first contacted each other, you mentioned you have a personal story with mental illness, and you said you'd be willing to talk about it. I want to go ahead and give you that platform right now.
sure. Yeah. So I kind of touched on this a little bit as we've gone along, but um, I went through childhood trauma. My parents were divorced when I was a baby. I didn't even know I had a father until I was almost 9 years old when my mother passed away. So she died when I was 8, about 3 months before my ninth birthday. And I went into grief, obviously. Um, and when the when it came to where I would be placed, a family court judge placed me with my father, who did not want me. I had never seen, never knew who he was. And as I grew up with him in a totally new place, new environment, new family, um, he was psychologically abusive. So I developed depression. I grew up from the age of 9 dealing with depression. And I it was never treated, never acknowledged
Mhm.
until much, much later in life. I ended up with a suicide attempt at the age of 18. And um, that was the very first time I ever had any interaction with the concept of mental health or therapy.
Mhm.
Um, I'd heard in high school, even took a psychology class, but that was the first time I'd ever had any direct contact with help. And I didn't stick with it at the time. I was still way too in turmoil life wise to do something healthy. Um, that didn't start until probably in my mid 20s when I actually started getting therapy and working on myself, and then ended up starting college, working on my bachelor's degree in psychology. Um, the way I did the introduction, I wanted to do it in a way to kind of encourage people that maybe at the beginning of the process, they may be not even yet ready to begin that process, that may be dealing with one of these issues, and it's just painful. It's just messing their life up. It did mine for decades, and it was a long time before I got on the right path, so to speak, in my journey, to where I was willing and able to accept the things that would help. And then it was a process. Then it was a road to take. And so it takes a long time once you get to that step, but it's possible. You can do it. From there, I you know, started, like I got my bachelor's degree, ended up getting my master's degree. I I wanted to help people. So I wanted a way to learn more about these issues for myself, and just for my curiosity, just for knowledge sake, and then try to find a way to apply them, to help other people. So yeah, I mentioned too that I have ADHD, so that was a great surprise too. I didn't realize that until later in life. Um, I think I probably had it, all along, but my depression was so bad and so untreated that some of these other symptoms with ADHD were just counted as part of depression, or just not recognized at all. Um, but yeah, so there are definitely ways to get help. There's a path to a calmer life, to having peace in your life. One of the greatest milestones in my life was a point to where I could sit down and say, wow, I feel peace. I feel peace, not because it's quiet in this room, not because there's nobody nagging me or cussing me or whatever, but I could feel peace internally and feel just normal. So it is possible, and it can happen.
And for anybody that's interested, I'll go ahead and link to Jamie's page so you can learn more about his work and check out his books. And 4 of the books are the 4 topics we discussed today on the program. And I want to thank you, Jamie Hughes, for sharing your time and expertise, sir. Appreciate it.
Yes, thank you. I enjoyed it very much.